So you always want to do the 6 rights of medication administration. So you want to make sure you have the right patient, the right medication, the right time, the right dose, the right route, and the right documentation. So you're going to go into your patient's room, knock on the door, introduce yourself, all the standard precautions. Wash your hands, ensure patient safety. Make sure they have their collar, not falling off the bed, there's nothing on the floor. Ensure privacy, close the door. If they have family, ask them to step out for a few minutes, if needed. Then you are going to make sure you're using the proper body mechanics and check their allergies. So we have an order to administer Chlorphorine 560 milligrams IV piggyback every 8 hours. And so we have a reconstituted bottle of Chlorphorine that is 500 milligrams per milliliter. It says to place in 50 milliliter 0.9 saline. Infuse over 45 minutes. Give 4 doses. So when we're doing all this, we're going to do the 3-check method. So our first check that we just did, the right patient, 2 patient identifiers, can I have your last name, date of birth. So we're doing that right now, making sure the order corresponds to the patient. And then we're going to do another check when we're getting our medications. And then that third check is at the patient bedside, where we want to do our 6 rights of medication administration again. So the right patient, the right medication, the right time, the right dose, right route, and the right documentation. So all those 6 things again. And then we want to make sure that the dosage is correct to their age and weight, and that should be in our chart here. And then you check with the physician for the correct dose and drop rate for that. So we're going to calculate the dosages for this. So this here says that we have the 500 milligrams per milliliter, and we need 560 milligrams. So 500 milligrams or 1 milliliter equals 560 milligrams over 1.1 milliliters. And so we did that math over here. We double checked it. Okay. So then when we're picking these out, we want to check the expiration dates on both of them. Look for any particulates. Make sure this isn't leaking. Make sure it's not discolored in any way. Okay. So we have this figured out of what we're going to get. We have our needle that we're going to use to draw out this medication. So we're going to draw up the 1.1 milliliters. And this is just a 22 gauge needle here. Okay. Pull that out. Set that down. The inside is still clean. We are going to clean the top of this with an alcohol swab. We are going to pull out the 1.1 milliliters of air. Gonna pop that in, put the air in, invert it, and take out the 1.1 milliliters. Making sure don't have any bubbles in there. Okay. No bubbles, all good here. Have your medication here. I'm gonna set it right back down. we are going to get this opened. So there is the medication port right there. And then you want to be careful. You want to make sure that doesn't go through the ends or anything. So we're going to insert that through. Okay. Now we're going to put this in. Okay. Gonna take that out. Put your safety thing there and put this in the sharps container. Okay. And then you have this here. You're going to label it with a medication label. So you're gonna, you can put it on the back, that way it doesn't block the top of this. But you're gonna write the medication that you put in there, the dose that you put in there, the time date, your initials, and an expiration date. And so then this is prepared and ready. Set that there. So then we are ready to open up our package here. Pull out our tubing. We're going to want to clamp it right away. So bring it all the way to the end. So you're going to close that secondary tubing. Then we're going to put it into our little bag of the 0.9 NS 50 milliliters. I'm going to take off this here. You're going to take off the spike, and you're not going to touch the spike or the top of that to anything. You want to maintain aseptic technique. You are going to spike your bag. Okay. You're going to squeeze your chamber. Got to push that out of the way. Okay. Then you're going to squeeze your chamber and fill it up halfway. And then just like before, you're going to prime your tubing by unclamping it and letting it go through the end. And you don't want it to drip out a lot because then you're losing your medication. So make sure you're really watching that and not a lot of this drips out. So you have that ready now. And then you're going to you're also going to label this tubing as well, because tubing is good for 24 hours. So, get your tape and label the time and date that you did this. Okay. And then you have this here. Gonna go on the top. You're going to lower your primary bag, and then you're going to hang your secondary bag to the top of the IV pole. And then you are ready to connect them. So you use the piggyback port that is above the roller clamp, so it's this one. So we are going to get our alcohol swabs. We can get some gloves on. We have our alcohol swabs. Going to remove the part here. We're going to clean both of them. New one, clean the top of the other one, and then we are good to hook them together. And then we're going to unclamp this here, and we're going to use this main one to set the drop rate. So to set the drop rate for that, we have to do some math. So if you have 50 milliliters of the 0.9 saline to infuse over 45 minutes, so that's 50 milliliters over 45 minutes equals X over 60 minutes. So when you do the math, it goes up to 67 drops per hour. Or sorry, 67 milliliters per hour. You divide 67 by 60, and that gives you 1.1. And you times that by your drop factor, which was 10, as it states on the secondary medication set wrapper. So 1.11 times 10 equals 11 drops per minute. So then you will watch here, and that's going pretty fast. So you're gonna, look at your clock and make sure that you have 11 drops per minute. So you have that going, and it's to infuse over 45 minutes and to give 4 doses. When your infusion is complete, you are going to close your secondary tubing. You are going to remove this here. You can put your gloves on, take this apart, clean that. You're going to put your main IV bag back up to the top, and then you're going to use the clamp and establish the rate that was already ordered before by the doctor. And then before you leave, make sure the patient doesn't have any questions, check their IVs, make sure the tubing is fine, everything is dropping at the rate that it's supposed to. Patient safety, give them their call light, and then you're going to document that you administered that.